Hi, I'm Dr. Ryan Novak, urologist at Grand Itasca. Vasectomies are an effective way at permanent sterilization. So for family planning and a couple who desires to not have any future kids, it's a great way to pursue that without requiring the use of anesthetic. It doesn't affect the other functions. A lot of times that's a concern that guys will have. How is this going to affect function going forward? And what it does is it stops the flow of sperm from the testicle to the appropriate tubes that allow it to be delivered. And by blocking that, then you can prevent having kids. Couples choose vasectomy, I guess, for a couple reasons. One reason is that they decide it's the guy's turn to participate. I don't know how to word that. So your wife made the appointment then. In the process of family planning, couples have a few options, and vasectomy is one option. That's obviously on the male end. On the female side, tubal ligation is an option. The procedure is about a 10-minute procedure in the clinic. I do this no scalpel technique, which leads to less swelling and discomfort afterwards. But to start the procedure, I use numbing medication, and patients will feel a little needle poke, just like when you go to the dentist. Once the medication kicks in, I just poke a hole in the scrotum, about the size of a pea, and I can get to both sides through the same spot. I take a little piece of the tube out. I don't leave anything permanent. After a vasectomy, there's typically some swelling and soreness, and the most important thing is to realize it shows up the next day, primarily. The night of the procedure, you may have a little bit of soreness, but typically not. The biggest challenge there is keeping guys the night of from doing too much activity. Most guys who are having this done are middle age and have a lot of family responsibilities, and sometimes push it a little too far in terms of activity. The biggest question is, what are my chances of having kids after the procedure? And there are reports of patients who've conceived a child after a vasectomy. The most important thing is to do the testing that's recommended about 3 months after the procedure. The testing is used to confirm that the patient is in fact sterile. So continuing to use appropriate family planning is important in that time frame until you get the test results back at 3 months. The decision is one of many choices. Families have many choices for family planning, but it's one of the choices I think that requires the least amount of effort. It should be considered a permanent procedure. It can be reversed, but it's an expensive procedure to have it reversed, and oftentimes insurance doesn't cover it. So I think it is important to go into it with the understanding that it should be permanent. If vasectomy is a part of your family planning, I encourage you to give my clinic a call. We can make an appointment, talk about the procedure, risks, benefits, and alternatives. Grand Itasca Clinic and Hospital, your health is our specialty.